Chapter 25 Mental Illness Psychiatric Disorder. Psychiatric disorder can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age senile dementia. Disorders in which there is no obvious pathology or anatomical change in our organ are termed functional. These are described below. Substance abuse. Abuse of a substance means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Affective disorder. Here is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotion, for example, happiness or sadness. Aff- Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss. Sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement, and thought. Psychomotor retardation, slowing of movement and thought. Loss of interest in stimulating activities. Decreased ability to think and concentrate. Feeling that one is of no value to other or that one has done something wrong. Recurrent thoughts of death or suicide. Five or possibly four of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. Neurotic and stress-related disorders. An example of neurotic disorder is obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. Compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands. Stress is feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. Other types of functional disorder. These include behavioral syndromes associated with physiological disturbance, such as eating disorder, disorders of adult personality and behavior, for example, personality disorder, mental retardation, delayed mental development, schizophrenia, and other disorder in which there are delusions, false beliefs. Complete the table with words from A, C, D, and E opposite. Noun, adjective, affect, affective, anxiety, anxious, behavior, behavioral, dementia, dem, dementia, demented, disturbance, disturbed, suicide, suicidal. Make word combination using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. Um, Substance abuse, sleep disturbance, psychomotor retardation, eating disorder, major depression, personality disorder, mental disorder, behavioral syndrome. Complete the sentences. Look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological changes is functional. And 6. An idea which forces a patient to repeat unnecessary action is a compulsion. Compulsion. Which symptom of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 56 years old woman presented to her GP complaining of lingering tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was 30 and was passing urine more often. She was eating normally and her weight was steady. The patient has three of the listed symptoms: tiredness, fatigue, loss of interest, sleeping poorly, insomnia. Over to you. Do you think the woman in 25.4 about was suffering from major depressive illness? Give your reasons. She does not meet the requirements for major depression as she has only three of the symptoms. Now, in Spanish. Enfermedad mental. Trastornos psiquiátricos. Los trastornos psiquiátricos se pueden dividir en orgánicos y funcionales. La demencia es un trastorno mental debido a una enfermedad cerebral orgánica. La forma más común de demencia es la asociada con la vejez, la demencia senil. Los trastornos en los que no hay una patología evidente ni un cambio anatómico en un órgano se denominan funcionales. Esto se describe a continuación. Abuso de sustancia. El abuso de sustancia significa usarla de una manera que es dañina. Las formas más comunes de abuso de sustancias son el alcoholismo y el abuso de drogas. Trastornos afectivos. Aquí hay un extracto de un libro de texto de medicina. Afecto y estado de ánimo tienen un significado similar y se refieren a las emociones, por ejemplo, felicidad o tristeza. Afecto tiende a usarse para emociones temporales y se expresa a través de la forma de hablar, la expresión facial o el comportamiento. Estado de ánimo se usa para referirse a un estado emocional más permanente. La forma más común de trastorno afectivo es la depresión, cuyos síntomas son falta de apetito o pérdida de peso significativa. Alteración del sueño, por ejemplo, insomnio, incapacidad para dormir, fatiga, que es pérdida de energía, agitación psicomotora, movimiento y pensamiento excesivo o retraso psicomotor, lentitud del movimiento y del pensamiento, pérdida de interés en actividades estimulantes, disminución de la capacidad para pensar y concentrarse, sensación de que uno no tiene ningún valor para los demás o de que ha hecho algo malo, pensamientos recurrentes de muerte o suicidio. Cinco o posiblemente cuatro de los síntomas anteriores que ocurren casi todos los días durante al menos 2 semanas constituyen una depresión mayor. Trastornos neuróticos y relacionados con el estrés. Un ejemplo de trastorno neurótico es el trastorno obsesivo compulsivo. Una obsesión es una idea tan persistente que interfiere con la vida del paciente. Una compulsión es una idea obsesiva que obliga al paciente a actuar aunque reconoce que es innecesario. Una forma común de esto es lavarse las manos compulsivamente. El estrés es una sensación de incapacidad para afrontar la situación. Puede provocar ansiedad o miedo a los problemas. Un ataque repentino de ansiedad se llama ataque de pánico. Otros tipos de trastornos funcionales. Estos incluyen síndrome síndrome conductuales asociados con trastornos fisiológicos como trastornos alimentarios, trastorno de personalidad y el comportamiento en adultos, por ejemplo, trastornos de la personalidad, retraso mental, que es retraso en el desarrollo mental, y esquizofrenia y otros trastornos en los que hay delirios, o sea, creencias falsas. Gracias.